What are the surgical steps for Hartmann's procedure? Imagine facing a serious problem in your colon that needs urgent attention. Hartmann's procedure is often the life-saving answer when diverticulitis causes perforation or infection. It involves removing the diseased part of the sigmoid colon and creating a temporary opening in the abdomen called a colostomy. Let's walk through the steps of this important surgery. First, the patient is prepared for surgery, which can be done through an open incision or with minimally invasive laparoscopic techniques. In laparoscopic cases, small ports are inserted into the abdomen to allow the surgeon to see and work inside. The patient is positioned with a slight tilt, usually with the head lower than the feet, to help move the intestines and improve access. Next, the surgeon explores the abdominal cavity, carefully inspecting the organs. They mobilize the small bowel and omentum away from the left lower side of the abdomen, where the diseased colon is located. Important landmarks like the ureter and blood vessels are identified to avoid injury. The surgeon then divides the lateral attachments of the sigmoid and descending colon, freeing the affected segment. Sometimes, the colon is mobilized all the way up to the splenic flexure, but often, especially in benign cases, the dissection is limited. The next step is to transect the diseased sigmoid colon, removing the infected or perforated part. The upper rectum and its surrounding tissue are also divided, leaving a rectal stump inside the abdomen. The proximal colon is then brought out through an incision in the left lower abdomen, where the surgeon creates an end colostomy. This diverts fecal flow away from the diseased area, helping infection to resolve. The rectal stump is closed securely and left inside the abdomen. Before finishing, the surgeon irrigates the abdominal cavity to remove any contamination, ensures bleeding is controlled, and then closes the incision or laparoscopic ports. This procedure avoids connecting the colon directly in a diseased or inflamed environment, reducing the risk of leaks. The colostomy is usually temporary, with the possibility of reversing it later once the patient recovers and the inflammation subsides. Hartmann's procedure is a critical surgical option in managing complicated diverticulitis, especially when infection or perforation makes primary reconnection unsafe. It provides effective infection control and bowel diversion, although it does mean living with a colostomy for a time. Reversal surgery can often restore normal bowel function, but this depends on the patient's overall health and recovery. Always remember, any surgical decision should be made in consultation with a qualified healthcare professional who can tailor treatment to individual needs.